Mary.
All right, thanks a lot, Agnes. Well, it often looks like the common cold with coughing, congestion, and fever, but it can progress into something much more serious. And while most children will have an RSV infection by the time they're about 2 years old, and they get better on their own, it is highly contagious and can be life-threatening for babies. Dr. Lyle Stevenson with the Pediatric Center is here to tell us how to protect our little ones from the spread of RSV. Thanks for coming in today.
Well, thank you. Thanks for having me.
And now we're kind of in that season where you're seeing more of it in our area. Is that right?
That's correct, Mary. Typically, RSV, or respiratory syncytial virus, is a upper respiratory virus that causes what initially looks like a common cold, but then it spreads to the lower respiratory tract or the lungs and causes wheezing, mucus production, and can cause especially tiny babies to have trouble breathing.
Okay. All right. So when do you know that it's gone beyond just the common cold to something more serious like RSV?
Well, RSV, the clinical syndrome that RSV causes is something called bronchiolitis, meaning inflammation of the smaller airways within the lungs. That happens due to mucus plugging and a lot of mucus being produced. Bronchiolitis is a clinical syndrome that we notice by history and physical. We look at fever, we look at wheezing, and it typically happens in ages 2 or younger. That's kind of what sets us apart from other causes of wheezing and the time of year. RSV is something that occurs between November to March.
All right, so now is the time that people should be on the lookout for that. At what point should you go ahead and make that appointment and bring your child into the doctor?
Well, first, anytime a parent is concerned, they should seek medical care. There's no absolute hard and fast reason. If you're concerned, we understand as pediatricians to come on in. But if the things to see with RSV especially is whenever it looks a little bit worse, like your child is having trouble breathing, if they're sucking in whenever they breathe on their chest or on above their sternum, things like that, or using more work to breathe than they normally do.
And mom and dads, you tend to pick up on those things. You're used to the way your child breathes, and you're used to even the little common colds and things, but when you notice that something is becoming a little bit more of a struggle, it's time to go ahead and make that appointment.
That's absolutely correct.
And you do make it very easy for parents to come in because the Pediatric Center is open. You're open late. You stay open to accommodate parents who are working.
We have 3 offices, and at our Sulphur office, we're open Monday through Friday. We're open Monday through Thursday, 8 a.m. to 8 p.m. On Friday, we're 8 to 5, and then we have Saturday and Sunday hours in the Sulphur office. We have the same hours Monday through Friday in the Lake Charles office and are open on Saturday as well, and then the Moss Bluff office is open Monday through Friday, 8 to 5.
All right, so you've got all those locations and all those hours and 10 practitioners, so you can really get your child in when you think there's a problem and have them looked at.
Absolutely.
Is there a vaccine for RSV?
There is a shot for RSV. It's what's known as a monoclonal antibody. It's available to children who were born less than 29 weeks of gestation, or to those children who are born with congenital heart defects. And what it does is it provides direct antibodies against RSV to try and keep those babies from getting RSV, and if they do, to make sure that it doesn't get bad. Because sometimes the first sign in a premature infant of RSV infection can be much more severe than an older child or a child that's more developed.
Okay, so if your child needs that shot, your doctor will let you know.
Absolutely.
All right. Well, if you have any questions about RSV, you can always call the Pediatric Center. They can tell you more, and you can always make an appointment with the doctors and get your child in and get them checked out. Thanks for coming in today.
Thank you so much.
Well, coming up after the break, how you can get your artwork on a big festival poster and enjoy some crawfish as well. We'll be right back.